So now let me discuss the pharmacogenetic conditions in the general pharmacology. Now what do you mean by this pharmacogenetic conditions? Remember a very important point. The genetic makeup is different in different individuals. So because the genetic makeup is different in different individuals, some drugs they have different effects in different individuals. So remember a point here, due to different genetic makeup. So due to different genetic makeup, what will happen is some of the drugs, alright, some of the drugs they have different effects in different individuals. Different effects in different individuals. Alright, that is, some drugs may show toxicity in some individuals, right? Some drugs may show toxicity in some individuals, and the same drugs, right? The same drugs may show no effect, right? The same drugs may show no effect in other group of individuals, right? May show no effect in other group of individuals if used in conventional dosage. Right, if used in the conventional dosage. That is what is called as your pharmacogenetic conditions. Now let me tell you some of the examples of this different genetic makeup and different action of the same drugs. Now these conditions, they include what is called as acetylator polymorphism, right? One of the different actions of the same drugs in different individuals is because of acetylator polymorphism. Now let me discuss what exactly is this. So the first one is acetylator polymorphism. Now what do you mean by this acetylator polymorphism? Remember a point here. Some of the individuals they are slow acetylators and the others they are fast acetylators. Okay, right? If you take the acetylators, some individuals, right? Some individuals they are considered to be fast acetylators, and the other group they are considered to be slow acetylators, right? The other group they are considered to be the slow acetylators. Now the drugs metabolized by this acetylation, right? The drugs which are metabolized by acetylation may be ineffective in case of fast acetylators, and these drugs may show toxicity in slow acetylators. Okay, so the drugs which are metabolized by acetylation may be ineffective right, may be ineffective in the fast acetylators, whereas the same drugs may show toxicity, right? The same drugs may show toxicity in slow acetylators. Now let me tell you the important drugs metabolized by acetylation, right? So the important drugs which are metabolized by the acetylation, right? Now you can remember this in the form of a mnemonic, that is SHIP, right? So these are the group of drugs which are metabolized by acetylation. Now what does this SHIP include? The word S includes sulfonamides, right? Sulfonamides including dapsone and para-amino salicylic acid, okay? Sulfonamides including dapsone and para-amino salicylic acid, right? Next, the word H will be what is called as hydralazine, right? Hydralazine. Next, the word I is your isoniazid, right? Isoniazid. Now if you take the sulfonamides, they are basically antibiotics, and you take hydralazine, it is the arteriolar vasodilator which is used as an antihypertensive drug, and you take isoniazid, this is a first line anti-tubercular drug, and the word P stands for procainamide, right? The word P stands for procainamide. So these are the important drugs which are metabolized by acetylation. Next, let me tell you a note here. All SHIP drugs, that is sulfonamides, hydralazine, isoniazid and procainamide, all these drugs can also cause a very important adverse effects, that is lupus erythematosus, right? This is a very important point. So all these drugs which are being metabolized by acetylation can cause an important adverse effect, that is SLE, right? Can cause an important adverse effect, that is lupus erythematosus or systemic lupus erythematosus. Now apart from these drugs, let me tell you the other drugs which are metabolized by acetylation. So the important drugs are sulfonamides, hydralazine, isoniazid and procainamide. Now apart from this, there are some other drugs which are metabolized by acetylation. They include acebutolol, right? I am telling you the list of drugs which are metabolized by acetylation. They include acebutolol, next we have amantadine, then we have amrinone, then we have benzocaine, next clonazepam, nitrazepam and then phenelzine. So these are the other drugs which are being metabolized by acetylation. The important drugs are SHIP, that is sulfonamides, hydralazine, isoniazid and as well as the procainamide. The other drugs include all these, that is acebutolol, amantadine, amrinone, benzocaine, clonazepam, nitrazepam and then phenelzine. So this is one of the genetic makeup which tells the different mechanism, the different action of the same drugs with different genetic makeup. So in those individuals who are fast acetylators, the drugs may be ineffective, and the drugs who are slow acetylators, the drug may show toxicity.